Hi, my name is Jayla Starks. Welcome to my case management assignment. For starters, I'll give a patient summary um, over my case management project. She is a 77-year-old female presenting to the outpatient clinic for weekly chemotherapy appointments. She lives in community housing slash homeless shelter with a roommate. I wasn't too sure if she lived in a shelter or if she lived in community housing. It wasn't too clear, so I just assumed that it was one of the two. Patient is low income. She has Medicare and Medicaid, and her comorbidities include heart failure, and she was recently diagnosed with anemia, and she will be required to get weekly iron infusions for the next 4 weeks. And then for a little bit of a clinical timeline, in April of 2026, she was diagnosed with breast cancer. And after that diagnosis, they initiated weekly palliative chemotherapy. In May of 2026, she completed 4 rounds of chemotherapy. She did develop persistent weight loss, decreased appetite, and decreased ability to keep food down. June of 2026, she was diagnosed with celiac disease, requiring her to make dietary changes, and now she needs weekly iron infusions. For her physical assessment, cardiovascular wise, she has a history of heart failure, and she presented to the clinic with bilateral lower extremity edema. Um, Integumentary slash hygiene, she presented visibly unkept. She often comes in with dirty hair, dirt under her nails. She can be malodorous sometimes, and her skin was very dry. Gastrointestinal, she was diagnosed with celiac disease, and she is having ongoing nausea despite the use of Finagrin and Zofran. Dental, she has poor dentition. She said that she hadn't seen a dentist in years. Um, I know a few times she had mentioned to me she was needing to go to the dentist, but she just couldn't find a way there. Musculoskeletal wise, she has weakness in her legs, and she does use a wheelchair. So, for my patient assessment, her physical needs include she has breast cancer, and she requires weekly outpatient chemotherapy and now weekly iron infusions. She has persistent weight loss and malnutrition due to her nausea and probably her celiac disease since she was newly diagnosed. She has weakness to lower limbs, and she uses a wheelchair for mobility most of the time. She has poor dental and personal hygiene, and she has heart failure with edema in her lower extremities. Um, for her emotional needs, she has anxiety related to breast cancer and ongoing treatment. Um, in the emotional distress can relate to her declining health as well. She is at risk for depression related to financial hardship, housing instability, and her cancer diagnosis and her other chronic illnesses. Her psychosocial needs include housing and food insecurity, difficulty attending multiple appointments unless coordinated on the same day, transportation issues. She is low income, and she's having trouble affording a gluten free diet. Um, so the family assessment, her family support is unknown. It seems like she doesn't have any family involved in her care. She usually attends appointments alone. I have not seen any caregivers, kids, or extended family that she's mentioned outside of her roommate. So patient strengths includes continues to attend weekly treatments, and she seems engaged with the healthcare team. She asks questions. She comes to her appointments as she's able, and she's willing to participate in treatment. So, some family concerns include limited caregiver support. As I mentioned, she comes to her appointments alone usually. Her roommate does offer some support with grocery shopping and small errands. She has a significant transportation burden and financial stress. So, some barriers to care for her include I'll start with the medical side. Chemotherapy side effects, such as the nausea and vomiting that she has, heart failure, iron deficiency anemia, celiac disease, malnutrition and weakness. Financial barriers include low income. She has trouble accessing gluten free foods that are within her price range. She is limited to Medicare and Medicaid for her health insurance. Transportation wise, she told me she has to schedule her rides 3 days in advance, and that can be kind of troublesome with scheduling her appointments. Um, Health literacy, she is newly diagnosed with celiac disease, and she still had questions about what food she can and can't eat. And she has a complex medication and treatment schedule. So, some short term goals that I made for her. Number one, patient will increase body weight by at least 5 pounds within 8 weeks. Number two, within 3 weeks, the patient will report decreased nausea before meals. Um, Number three, within 30 days, patient will meet with oncology social worker and enroll in at least three available community resources given by the social worker. Number four, patient will attend a Medicaid approved dental evaluation within 30 days to address her poor dentition. And number five, within 2 weeks, a patient will select and consume at least two affordable gluten free nutritional alternatives with the help of a dietitian. For long term goals for her, number one, within 6 months, patient will improve functional status by working with physical therapy. Two, within 12 months, patient will report improvement in overall quality of life, demonstrated by maintaining a stable body weight and improvement in nausea. Number three, patient will complete chemotherapy treatments by the expected end date of January 2027. The interdisciplinary team working with her will include the medical oncology team, so like the doctor, the nurse practitioner, the RNs on in our clinic, and I included the nurse navigator as well. All these people can help manage symptoms related to chemotherapy. The registered dietitian improve weight and nutritional intake. The social worker can address housing, food insecurity, and transportation. Physical therapists can help the patient improve strength and reduce her fall risk since she has limited mobility in her lower extremities. Also, she can visit the community health center. I think she would have to have a referral from the social worker to go there. Um, but Phoenix Healthcare for the Homeless offers supportive housing for homeless people. They can help with dental care, primary care, and respite care for after discharge from a hospital to continue recovery if she were ever to be admitted. For her care plan, I included a few different things. For symptom management, um, we will work to manage chemo related nausea, vomiting, fatigue, and anemia. All these things can help improve treatment tolerance, her nutritional intake, and improve her overall quality of life while reducing the risk of treatment delays. Nutritional support, collaboration with a registered dietitian to develop a affordable gluten-free meal plan and then identify alternative nutritional supplements to address malnutrition can also help with treatment delays and making sure she adheres to her treatment plan. Working with social work can offer financial assistance. So, placing that referral to social work can help connect the patient with financial assistance programs, food resources, housing support, and transportation services to reduce barriers to care. For mobility and fall prevention, I think PT evaluations would work well for her. Wheelchair safety education and fall prevention strategies can improve her overall functional mobility, help her maintain some of the independence that she has, and decrease her risk of injury. Um, for transportation coordination, we can try to work more with the oncology team, like the nurse navigator, to coordinate her chemo, iron, and provider appointments to hopefully be all on the same day if possible, so that the patient has transportation and she can let her transportation company know for days in advance, like she has to, in hopes that this will prevent mistreatment days. So, some education for her will include infection prevention, neutropenic precautions, heart failure management, a gluten free diet and nutrition, managing nausea, vomiting, and fatigue during chemo, medication adherence, when to call the oncology office or go to the ER. During her education, I plan to utilize plain language and the teach back method. I will communicate with the healthcare team via phone and through attending interdisciplinary meetings. So, for her continuity of care, her social determinants of health impact include homelessness, extreme poverty, and food insecurity. Those are the primary drivers of the patient's physical decline, which complicating standard care in the oncology clinic. A closed loop communication system is to be established between the oncology clinic staff, providers, and case management. Some ethical considerations include making sure the patient receives equitable health care regardless of financial or housing status, and that basically informing the patient that they have the right to make informed decisions regarding chemo or infusions and dietary recommendations. And with the legal side of things, we have to make sure we obtain informed consent, which is usually done before we even start chemotherapy. We have to ensure accurate and timely documentation and provide patient privacy in accordance with HIPAA laws. And for advocacy, the case manager has the responsibility to advocate for the patient's needs, thereby reducing barriers to care. And we will facilitate referrals and ensure the patient has access to resources necessary to continue treatment safely. So, some expected outcomes for her include the successful completion of chemotherapy. Since her treatment is palliative, I'm not sure if she is going to do chemo and then switch to immunotherapy. I think it depends on what her scans look like and her progress to chemotherapy looks like. We hope to maintain improved nutritional status, improve quality of life, and improve symptom management and prevent infection. And these are my references. And thank you for listening to my presentation.